Nigeria has indicated that the health sector has priority within the human capital development thrust of Nigeria's transformation agenda. It is against this backdrop that the federal government has launched the Saving 1 Million Lives initiative aimed at saving the lives of women and children. Now, to look at the progress in the sector and how the scheme is expected to work, we have from Abuja Dr. Mohammed Pate. He's Nigeria's Minister of State for Health. A very good evening to you, Minister. Now, we have seen in recent times there have been a number of efforts really to reduce infant mortality and as well the fight against polio and other killer diseases. Could you kindly give us an update on the kind of achievements that we have seen coming through with the government's drive towards the National Health Transformation Program?
Yes, thank you. In recent years, we've seen the federal government deploy thousands of midwives all over rural primary healthcare centers in Nigeria and has initiated a scheme that is providing conditional cash transfer for pregnant women using the amount of money that we've saved from the subsidy reform. And the second component of the Saving 1 Million Lives initiative is to do with improving routine immunization, which is very cost effective. We've introduced new vaccines to prevent children from getting diseases like pneumonia from bacterial causes, alongside improvement in polio eradication initiative, where we're seeing less and less children, in fact, or less number of local government areas that have polio cases, even though in some other areas there are still wild polio viruses being circulating. And the third element of it is improving the effort to prevent mother-to-child transmission of HIV, improving malaria, reduce deaths from diarrheal diseases, and use innovations such as the use of mobile technology, given the high penetration that we have in mobile technology, to improve access to health services and the way the health sector is governed. On the other hand, there's an effort on improving prevention of non-communicable diseases and unlocking the private sector market potential in the health sector.
Well, indeed, it is believed that the initiative is expected to target around 6 million women and children in Nigeria. But could you kindly talk us through how all of this is going to be rolled out to ensure that all women and children get the vaccines that are necessary?
His Excellency, Mr. President, and the Prime Minister of Norway are co-chairs of the United Nations Commission on Life-Saving Commodities for Women and Children. The Commission made recommendations around 13 commodities that are essential to saving the lives of women all over the world. It made 10 recommendations, and they are now being implemented. Now, that report would lead to saving 6 million lives all over the world if the commodities are made available in different countries, mostly in developing world. But in Nigeria, we do know that it is possible to save 1 million lives from now until 2015 if we can increase access to basic health services. And that's why Mr. President has prioritized this as part of his transformation agenda for Nigeria. And the rollout will be in such a way that the states and local governments are key stakeholders, and the Governors Forum has pledged its support. All the 36 governors has pledged their support through the Governors Forum to support this initiative of Mr. President. But the private sector is also not left behind. The Nigeria Private Sector Alliance, led by Mr. Jim Ovia, who is chairman of Visafone, and with the support of individuals like Alhaji Aliko Dangote and Mr. Imokode, have pledged to work with the government in driving this movement to improve the welfare and save the lives of many thousands and at least million women and children from now until 2015. Our traditional and religious leaders have also come out to pledge their support. The president of the Christian Association of Nigeria pledged the support of the faith establishment in this effort of government. So also are our development partners. Let me finish by saying the government of Norway did a remarkable show of commitment by pledging additional resources, particularly focused on diarrheal diseases, as well as the use of mobile technology to improve access to basic services. Now, alongside other bilateral partners like the US government, we're very confident that the coalition approach, the partnership approach that we're putting together will sustain this movement for Nigeria to save at least 1 million lives from now until 2015.
Indeed, you did touch on the Norwegian government offering about $25 million to this new initiative. But what other programs are you perhaps initiating in order to improve this?
Well, there is another element, which is the private health sector. As we know, Nigeria's health sector is a mixed healthcare system. There's a significant private health sector involvement in provision, but there's a whole health sector value chain that can be unleashed so that not only it provides services to people, but it can also contribute meaningfully to economic development. We've worked with major entities like the International Finance Corporation of the World Bank, as well as other critical stakeholders, to really understand the constraints to private health sector growth. And the policy constraints have been identified. The regulatory constraints, we're working to relieve them. And access to capital has been a major issue where the private sector has conveyed. And government is looking at those areas so that in the future, we can unleash the potential in the private health sector so that Nigeria's health sector can also not only serve the domestic market, but potentially reverse those who are going abroad for medical tourism to stay home and get the care they need, as well as others from outside the country can come here and get care.